Hi friends, today our topic is shock. So what is shock? Shock is any situation where there is an inadequate perfusion to the tissues. So inadequate perfusion means the blood supply to the tissues leads to decreased O2 supply in the tissues. So further it leads to ischemia. So because of the ischemia the tissue becomes necrotic or they may die. And if this condition is not reversed in a time, so there may be an organ failure, which is the progressive state. So the main symptom of the shock is decreased BP. So there are two causes of this, that is because of decreased cardiac output and decreased systemic vascular resistance. So this is the overall review of the shock we are going to discuss. So there are types we are further discussing about the shocks. Here now we will focus on the first type of shock, that is the hypovolemic shock. Hypovolemia means the loss of volume. So it may be blood or fluid in the body. So first we will discuss about the etiology or the causes of hypovolemic shock. So we are discussed these causes into two parts. The first part is blood loss and the second part is fluid loss. So the first is GI bleed. Any bleeding, internal bleeding in the GI system may lead to hypovolemic shock. Trauma, if any accident is there happening, so it can be lead to hypovolemic shock. If more blood is gone in this accident. PPH, the postpartum hemorrhage. It is the obstetric condition in which after the delivery there is a lot of blood loss, then which ectopic pregnancy. Ectopic pregnancy means pregnancy is taken place other than the uterus in any part in the female reproductive system, which may be infundibulum or the fallopian tubes. Hemoptysis. Hemoptysis is the coughing of blood. So if we cough more amount of blood, so there is the blood loss, so which it leads to the hypovolemic shock. Now we will focus on the non-blood fluid loss. So the first one is the third degree burn. But in burn there is a lot of fluid loss from the body, excessive vomiting, diarrhea, bowel obstruction. Then fifth one is the acute pancreatitis, and last one is the diabetic ketoacidosis. So because of the diabetic ketoacidosis, because of the increased glucose in the blood, there is a lot of urine produced, so it leads to the fluid loss from the body, and it is the main cause. So these are the causes of the hypovolemic shock. So now we will focus on the symptoms of hypovolemic shock. The first one is cyanosis. Cyanosis is generally means the bluish discoloration of the body or the part. So the first one is lips, tongues, fingertips, toes. Hypoxia. So in extreme condition there may be the multi-system organ failure. So management, we will focus on the management part now. So how it can be reversed? So if the patient is having symptoms like cyanosis, hypoxia, and the main feature, that is the low BP, so we give lots of fluids and crystalloids. These are NS or RL, Albumin if there is a decreased oncotic pressure in the body, and the transfusion, blood transfusion may be given if there is a lot of amount of blood has gone from the body. So this is the management part. So now we will focus on the cardiogenic shock. So what are the causes of the cardiogenic shock? The cardiogenic shock includes the causes related to the heart. When there is a dysfunction or the heart is not properly functioning, so cardiogenic shock may take place. So the first etiology is the myocarditis. Myocarditis is the inflammation of the myocardium. Multiple MI, multiple heart attack if patient is having. Aortic valve stenosis. If there is the stenosis of the aortic valve through which the blood passes, so mitral valve stenosis is also there. Arrhythmias. Arrhythmias may be increased heart rate, may be the cause, or the decreased heart rate, which we can call as bradycardia or tachycardia. Dilated cardiomyopathy and the congenital heart diseases. So the dilated cardiomyopathy, so dilated cardiomyopathy in which uh, the myocardium is not able to function properly, and the congenital heart diseases also affect and leads to the cardiogenic shock. So these are the causes of the cardiogenic shock. So now we will focus on the symptoms and the management part of the cardiogenic shock. So the symptoms are the decreased BP, metabolic acidosis is there because of the low O2, there is the lactic acid production, and because of the decreased ATP there is the lactic acid production which leads to the metabolic acidosis in the body, and we will focus on the management part. So we have to treat the symptomatic causes of the cardiogenic shock. First, if the person is having MI, so angioplasty should be done and it should be placed on, the patient should be put on the thrombolytics such as ecospirin, O2 support. If there is the acidosis and person is not able to breathe properly, so O2 support should be there. Vasopressors in extreme condition, vasopressors such as adrenaline, epinephrine or adrenaline should be used, and this one, that is the IIBP. This is the intra-aortic balloon pump. So what is intra-aortic balloon pump? So when there is the heart contracts, so it helps heart to revive more blood, and as in the old patient the valves become the weak, so the balloon helps the valve to retain blood and try to function the functioning of the heart properly. So these are the management of the cardiogenic shock. Thank you.